Okay, thank you very much. Good evening, everyone. My name is Raymond. I'm an advocate with Disability Rights California, and with me today is Leilani Pfeiffer and our presenter, one of our senior attorneys, Maria Iriarte. Just a quick overview of our agency. We are Disability Rights California. As I said, we are a statewide nonprofit agency, and we provide free legal services to people with disabilities with disability-related issues. Some examples on the issues we work on. It could be on special education. It could be on public health benefits such as Medi-Cal, the presentation today, IHSS in-home support services. We also work with clients of the Department of Rehab and clients of the Regional Center. If you have access to the chat, we have our intake line in the chat. If you can't access the chat for whatever reason, it will be in the email when the material is sent out to your group coordinator, and they will help distribute along with the materials. Any links in the chat will also be in the email. Um, if you like a private appointment with Maria to discuss your issue, um, you can contact me. I will put my contact information in the chat. Like I said, if you don't have access, it could be sent out to you in the follow-up email as well. You can talk to Maria privately. It's no commitment. It's confidential. You can talk about either Medi-Cal or any other issues that you might be facing with in-home supportive services, uh, any disability-related issues. And if you have any questions, you can feel free to type in the chat. And if you don't have access to the chat, our presenter Maria will pause periodically, and you are more than welcome to unmute yourself and ask your questions. And I think I covered everything. So without further ado, Maria, please take it away.
Great. Thank you, Raymond. Good afternoon, everyone. So the topic today is Medi-Cal. We're going to talk about the basics, but we're going to talk about a lot of things. So I'm going to give you some background on Medi-Cal, the terms and the players, some Medi-Cal eligibility basics. You're going to get a link where you can find the different Medi-Cal programs for people with disabilities. There are many Medi-Cal programs in California. There's not just one Medi-Cal program. Maybe definitely over 60 Medi-Cal programs in California, and each program has its own criteria for eligibility. But some of the programs that we deal with for persons with disabilities have some similar features, similar requirements. We're going to talk about Medi-Cal services and what happens with Medi-Cal when you have other health coverage, whether it be private insurance or Medicare. So people and terms and players. So when you hear the word Medicaid, it's the same thing as Medi-Cal. California just decided to name its Medicaid program Medi-Cal. The federal agency that administers the Medi-Cal program nationwide is called the Centers for Medicare and Medicaid, and we call it CMS. That's the acronym. The state agency in California who's responsible for the Medicaid program in California is called the Department of Healthcare Services. It does delegate some of its responsibilities to other agencies. So for example, IHSS, in-home supported services, is a Medi-Cal service, but California Department of Healthcare Services has a memorandum of understanding. It's a contract between it and the California Department of Social Services, so known as CDSS. They administer the IHSS program statewide. So when California decided to take federal money, it's called federal financial participation, it had to submit to CMS a state plan which describes the nature and scope of the program, who's going to be covered, what services are going to be provided, what rights are going to be protected, what's the administration of the program. And that's all within the state plan that was approved by CMS. When California decided to enter into to participate in the Medicaid program, it also agreed to follow federal rules and regulations and guidelines. And so in California, we have Medi-Cal programs where the federal government is helping to pay the service, and that's called federal financial participation. And we have Medi-Cal programs where only the state is paying. So there's no federal financial participation. There's a link in the PowerPoint to a, oh gosh, I just lost the PowerPoint. There's a link in the PowerPoint to the state's plan. So if you're ever interested in seeing California state Medi-Cal plan, you can go there. Now I want to switch to delivery models. So there are two in California. You either have fee for service, meaning that you have Medi-Cal where you can go to any provider who takes Medi-Cal anywhere in the state. The other way is through a managed care plan. So we were discussing partnership. That's a Medi-Cal managed care plan. The majority of people in California who have Medi-Cal are in a Medi-Cal managed care plan. What happened some years ago in Los Angeles, Orange, Riverside, San Bernardino, San Diego, San Mateo, and Santa Clara counties is that I don't think you guys are in any of these counties, but they created a pilot project called the California Care Initiative, where it did three things. It moved more people into managed care. It allowed people who had Medicare and Medi-Cal to have their Medi-Cal managed care plan take over their Medicare. That's called Cal Medi Connect. They figured that having it all under one roof would be better care coordination, right? And then some long-term support services like IHSS, community-based adult services, the multi-purpose senior services program. These are all IHSS services. You would have to go through, you would have to be in a managed care plan to get. It didn't work out so well for IHSS. So back in January 1st of 2018, they changed it for IHSS. So you no longer need to be in a managed care plan to get IHSS. And the multi-senior services program also starting this year was you no longer needed to be in a Medi-Cal managed care plan to access that. And there are links to more information on this.
Maria, just so you know, there are people on the call that are from Santa Clara County.
Okay, so then, yeah, so your county participates in the coordinated care initiative. So those are the three things that, that happened as a result of that initiative in Santa Clara. Great, thank you for clarifying that. Services, you might hear the word, I have full scope Medi-Cal or I have restricted Medi-Cal. Full scope means that you get to ask for the range of services in the state plan, right? Everything under the sun. You can ask for it, that you get it is another story, but waiver services, durable medical equipment, mental health, supplies, hospital transportation, long-term support services, nursing home. Restricted, people get restricted Medi-Cal because of their immigration status. So there's something called emergency Medi-Cal. So if you don't have the proper immigration status, you can still get Medi-Cal for the emergency or pregnancy related care or long-term care. Starting January 1st of 2 years ago, January 2020, the law changed with regard to immigration status. So anyone below the age of 26 does not have to worry about their immigration status. Medi-Cal doesn't care anymore what your immigration status is. And so therefore you can apply for Medi-Cal regardless of your immigration status, but you still have to meet the other criteria for that particular Medi-Cal program, right? The rules regarding income and resources and that kind of thing. And starting in May of this year, people 50 and over can apply for Medi-Cal regardless of their immigration status. So again, they have to meet the other eligibility criteria for the Medi-Cal program. When California agreed to participate in the Medicaid program, it had to follow federal rules. So it had to include services the federal government said you have to have, like hospital, doctor, lab, extra services for kids. But and it could opt to have other services if it wants. And California has a lot of services that are optional. They don't have to provide them under the law. So we're talking about physical therapy, occupational therapy, speech, psychological services, durable medical equipment. There's a lot of stuff that California does not have to cover, and they would be okay. They haven't violated any rules, but they do. And sometimes they take away those some services, sometimes they bring them back. The link at the bottom of this PowerPoint page has a link to a guide on Medi-Cal services. It's really good. It was put together by a national organization called NHELP. They do a lot of impact litigation and they write really good publications. So if you ever want to know more about services, you can go to that manual. But talking about services, it's not enough for you to say, or your doctor to say, oh, Maria, she needs a power wheelchair because it'll help her get around the community. That's not enough. For any service that you ask for under Medi-Cal and really under any health insurer, you have to meet the medical necessity standard. And, Medi-Cal has its own definitions of medical necessity. Every other program has its own definitions. Your private insurance will have a definition of what's medically necessary. And for Medi-Cal, there's a medical necessity standard for adults and another one for kids under the age of 21. So for adults, for something to be medically necessary, you have to show that it is reasonable and necessary to protect life, prevent significant illness or significant disability, or alleviate severe pain. Whereas with kids, all you have to show is that what you're asking for is medically necessary to correct or ameliorate a defect, physical or mental illness or condition. So for kids under the age of 21, the medical necessity standard is much broader, right? Whereas with the adult standard, it's a little tougher to get. So when your Medi-Cal doctor prescribes something, it's not only the prescription, but the doctor out or whoever it is that's prescribing the service or the equipment, you have to show, the doctor professional will have to show why this is medically necessary for you, right? And there are many services and equipment that have all other kinds of criteria to get them, but universal is the requirement to meet the medical necessity standard. I'm going to stop right now to see if there are any questions, because now I'm going to talk about some of the basics regarding eligibility for people with disabilities. Like I said, there are many Medi-Cal programs, and there are people with disabilities who are on Medi-Cal programs where disability is not a requirement because of their situation, their income, maybe their family members of, whatever the situation, they're not in a Medi-Cal program where disability is required. We work with, obviously, we serve people with disabilities, and so we focus on those programs where disability is a requirement. So I'm going to stop right now to see if there are any questions.
I don't see.
Yes, you were saying earlier that the Medicaid will decide if they're going to pay for something like a drug. Would that be an issue?
Yes, it has to be medically necessary. Whatever you ask for has to be medically necessary. And if you're an adult, the doctor, whoever's prescribing it, has to show that it's necessary to protect your life, prevent significant illness or significant disability, or alleviate severe pain. If you're under 21, all you have to show, and this is really the doctors, the health professionals doing this, all you have to show is that whatever you're asking for is necessary to correct or ameliorate a defect, physical or mental illness or condition. That's the medical necessity requirement.
Okay, thank you.
Mm-hmm.
Is there a Medi-Cal plan for a situation for a family where someone is on Social Security and has Medicare, but one person is working and not on Medicare, but a child could qualify who isn't disabled, and the family household makes $80,000 or less combined?
That's a really hard question to answer because there are so many Medi-Cal programs out there. When you say receiving Social Security, are you talking about SSI or something else?
SSDI.
Okay, so a parent is receiving SSDI. There
Yes.
are benefits for children, even if they're not disabled. And those, if a parent is on SSDI, children, I think below the age of 16 can get money benefit. They don't have to show that they're disabled, but it'll stop. But if you're an adult child and you're disabled and your parent either retires and starts getting Social Security, dies and would have been eligible for Social Security, or starts to get Social Security disability insurance because that parent became disabled before his or her retirement age, and you as the person with the disability were disabled before the age of 22, you might be entitled to what are called disabled adult child benefits. Yeah.
Okay. Thank you. Yeah, we pay for our son's Kaiser, but I wonder if he is eligible for, Cover California or Medi-Cal or something like that instead of the full, $200, Kaiser.
Well, he could apply, and
I guess it couldn't hurt to
there's a simple
apply.
application for Medi-Cal in Covered California. So if the Medi-Cal eligibility worker finds that your son is not eligible for Medi-Cal, they'll look to Covered California to see if there's anything there.
Okay. Yeah, that's worth a shot. Yeah, thank you.
Maria, I have one more question. Sorry. So if our daughter Anurishma, if we needed to get speech therapy for her, she has to relearn English sounds because being totally blind, she couldn't see the way the tongue was moving to be able to learn English. Do we need to get a referral in order to have Medi-Cal help pay for that speech therapy?
Have you addressed this with her primary care doctor? Does she have Medi-Cal through a managed care plan?
Yes, I believe.
Okay, so you need to address that with her pediatrician. And he has to make the referral to either a speech therapy evaluation. I think that's what it would be. And then based on the evaluation, that, if they find that she needs it, then the next question is, well, what does she need and how much?
So if we have IEEs, independent education evaluations from the school district, is that something that they listen to, or do you have to go?
No, they make their own determinations. They make based on medical necessity, right?
Yeah.
It's all based and the need, and there may be special criteria for obtaining speech therapy services. So yeah, I mean, it can't hurt to show it if an independent evaluation that says that she needs it, so that at least they know, that she's been assessed and that someone has found that she needs it. But Medi-Cal will make its own the managed care plan will apply the Medi-Cal rules.
Okay, great. Thank you. Charlene just entered the meeting. Hi, Charlene.
Okay. So we're going to go, if there are no more questions, we're going to talk about some eligibility. So there's a link on the PowerPoint slide that you have in front of you it's called Medi-Cal aid codes. So if you want to know what Medi-Cal program you're on, you could find out what your aid code by calling your Medi-Cal eligibility worker and saying, hey, what Medi-Cal program am I on? Or, hey, what's my Medi-Cal aid code? And if you get your Medi-Cal aid code, you can open the link and find out what program you're on. So when people call us when they call me, when they have a Medi-Cal question, the first thing I want to know is, what program are you on? Because that will inform me as to what I need to be doing, what program I need to be looking at the criteria, and to be able to advise, right? So there are Medi-Cal program. When you get SSI, you automatically get Medi-Cal, and that Medi-Cal is called categorically linked to SSI. But if you lose that Medi-Cal because you no longer get SSI, you can continue with your Medi-Cal under, maybe there are a lot of other Medi-Cal programs. So I guess what I want to say is that if you lose your SSI, you're going to lose your Medi-Cal that's categorically linked to your SSI, but it doesn't mean necessarily that you're going to lose your Medi-Cal, because there are a lot of programs out there. But the programs that we deal with, we'll look at income, we'll look at resources. Immigration status is starting to be not a big deal, because anyone below the age of 26, it doesn't matter what your immigration status. And starting in May, anyone above 50, doesn't matter what your immigration status is. Well, you definitely have to be a California resident to get Medi-Cal, right? Because every state has its own Medicaid program. When the Medi-Cal program is looking at income, and these are, like I said, every program has its rules, but you know, when we're talking about the programs for people with disabilities, there are common themes, like what income are they going to be looking at? They're going to be looking at income, earned income from wages or self-employment, unearned income, like maybe you're receiving Social Security disability insurance, unemployment, pensions, annuities, whatever income you get, not from earned income. There's another type of income called in-kind shelter, in-kind support and maintenance, in-kind shelter. So if someone is paying, if you live with other people and you're an adult, 18 or over, and you're and you live with other people in the house, and they're either providing all of your food and or all of your shelter, then the Medi-Cal program will say, well, you're receiving a form of income, it's unearned, because these people in the household are helping you with your expenses. And so that will have a dollar value, right? But in order for that to apply, they have to be paying for all of your food and or all of your shelter. So you can avoid that by paying something of your food and something of your shelter. If income is not available to you, then it's not counted towards Medi-Cal eligibility. So, you know, this includes funds that the applicant doesn't have access to, and income brought in by an unrelated adult or adult child living in the home. There's exempt income. There's income that just will not be counted as income. Public assistance like general relief, SSI, CalWORKS, CalFresh, government programs, foster care payments, housing assistance. And the rule with regard to Medi-Cal is money is income in the month received, and anything left over the following month is a resource. So people get into trouble when they keep too much money in their savings account or banking account and it goes above the resource limits, then they become disqualified for Medi-Cal. Although, as we'll see later, there are some changes coming to the resource limits for the programs that we deal with. If you receive a lump sum payment, like a retroactive IHSS payment, SSI payment, an inheritance, you win the lottery, you know, we have a publication, and the link is down at the bottom. It's about what do you do, how much time, when is that lump sum payment considered income, and when is it considered a resource? Because for some of these payments, you're going to have time to spend it down. And when the Medi-Cal program looks at income, it looks at countable income. So if you have unearned income, they allow you to take $20 out of your unearned income, and the result is your countable income. But if you're on SSI and you're working, you can deduct, you get your gross income, you deduct $65. And if you didn't use that $20 unearned income deduction, you can take it out there. You divide that by half, and that becomes your countable income. But if you have like blind work expenses, these are expenses that are approved by Social Security that you pay out of pocket in order to work, or impairment related work expenses. Those are for people who, it's not based on blindness, but other disabilities. Theirs is called impairment related work expenses. For people with visual impairments, it's blind work expenses. You can deduct those too from your gross income. So it will always be beneficial to work and be on SSI than to not to work, because your net income will always be greater. That, it's important to also know the work rules. If you're on SSI, the work rules are really simple. It's this formula. But if you're on SSDI, also the work rules are very different. And there's a red book that's put out by Social Security that talks about all these work rules, and either Raymond or Lonnie will put that in the chat so that you can have it. I'm going to talk about resources, but I want to just say that, for the SSI resource and the Medi-Cal resource limits for a lot of the programs we deal with, you can't have, if you're an individual applying, like an adult 18 or over applying for this program, you can only have $2,000 in countable resources. A couple applying can only have $3,000 in countable resource. So the Cal Able program, the Able program allows you to keep up to put $16,000 in an account, and it won't affect your Medi-Cal, it won't affect your SSI. And if you have SSI, you can keep up to $100,000 in your Able account, and you can use that money, oh gosh, to do so many things that you would never be able to do if you were just on SSI, because you could never save. They keep you in poverty, right? They keep you, that you can't have more than $2,000 in countable resources. When are you going to be able to save for a car, or use money to get Uber and Lyft and taxis and, whatever, buy a home, remodel your home, do modifications, go on a vacation, hire an attorney, take a class, whatever it is. Couldn't do that if you were not on Able. And there's a link to the Able program, and I heard a couple of you talking about opening up an Able account, so that's really great. There are things that don't count as resources. So the home that you live in and own is not a resource. One car, no matter what the price, is not a resource. If you use another car for trade or business, you use it for your trade or business, and the tools for your trade and business don't count. Personal effects like clothing, wedding and engagement rings, and other jewelry with a net value of 100 are not counted. Household items are not counted. Life insurance policies can't have a more than $1,500 combined face value. And these are just examples of resources that are not counted. There are more. When you acquire a resource or get rid of a resource, you have to report that to Medi-Cal within 10 days, especially of whatever happened, you got a resource, because the resource may or may not disqualify you for the Medi-Cal program. Because you remember, if you get a resource that counts, it may take you over the limit, right? So really tricky. There's something called deeming. So with Medi-Cal and also with SSI, if you're a minor child below the age of 18 and you want to apply for Medi-Cal, your parents' income and resources, the parent with whom you live, their income and resources will count as if they were yours. And that might disqualify for Medi-Cal because you're either over-resourced and or over income. If you're married, your spouse's income and resources will count as if they were yours. And if you were sponsored into the US to become a lawful permanent resident, someone signed an affidavit saying that they would take care of you, make sure you had a roof over your head, et cetera, and the person turns around and starts to ask for benefits, it's possible that the sponsor's income and resources will always also be deemed. How do you avoid that? You avoid deeming by getting on what is called a home and community-based waiver. With regional center clients, they get to apply for what is called the DD waiver. There are other waivers, including the home and community-based alternative waivers. And these waivers have language in the document that says to the Medi-Cal eligibility worker, if this person is eligible for a waiver, and to be eligible for a waiver, these The criteria is that if you were not living at home, you would be able to enter a facility at whatever levels of care, right? So, and the waiver will give you extra services that other people on Medi-Cal cannot get. So if you qualify for the waiver, then when Medi-Cal does its determination as to whether you qualify for Medi-Cal, because you have to qualify for Medi-Cal to get the waiver, because the waiver is a Medi-Cal service, then the Medi-Cal eligibility worker pretends that the applicant for Medi-Cal is living in an institution, hence institutional deeming. So they will not look at the parent's income or resources. They will not look at the spouse's income or resources in order to qualify the person for Medi-Cal. There is no exception for SSI, none. Medi-Cal has this exception. So, and there are a number of waivers in California, the self-determination waiver through the regional center, the assisted living waiver, the AIDS waiver, the multi-purpose senior services waiver for people 65 and older. And all of these waivers will give you extra services that other people who have Medi-Cal will not get. So this is a really good example. Let's say that I need nursing care. And I have Medi-Cal. My choices are to try to piece together services like IHSS or whatever, so I can remain at home or go into a nursing home paid for by Medi-Cal. But if I'm on a waiver, I can get nursing care at home. If I'm not on the waiver, I can't get nursing care at home. And waiver has a lot, like the service, there's long list of services that people can get on the waiver that other people on Medi-Cal could not get. And I do a training on waivers in more detail, but immigration status, we know that things are changing with that. It's not a big deal so much anymore, but you could be the first 5 years, lawful permanent residents, refugees, asylees, battered spouses, victims of trafficking, people who are qualified for Medi-Cal under a category called persons residing under color of law. And that includes a long list of immigration statuses, like people who've been granted stay of deportation, granted indefinite voluntary departure, are in deferred action status. And finally, and these are just examples because it's a long list, people who the government knows are here not legally, but the government has no intention of deporting them. And now with immigration status not being a requirement for anyone below 26, and in May, anyone above 50, you're going to really open up the opportunity for more people to qualify for Medi-Cal. And of course, you have to be a California resident to be on Medi-Cal. The next thing I'm going to do is I'm going to talk about some of those programs that we work with that are focused where a criteria is disability, and one where it's not, where we have clients who are on this program, the modified adjusted gross income, or the MAGI program. They're disabled, but disability is not a criteria for eligibility. So I'm going to stop right now to see if there are any questions.
Yes, I had a question. So if we get social disability income and we receive Medicare and Medicaid, we can only have less than $2,000 in our savings account in order to get the Medicaid?
Yes. Yes,
Oh, okay.
but it depends on what Medi-Cal program you're on.
Oh, okay.
Because, for example, the one I'm going to talk about, the MAGI Medi-Cal program, they don't care what you have in your savings account. They don't care about resources.
Okay.
So the first thing for you to figure out whether you have an issue or not is to find out what Medi-Cal program you're on. And a couple of ways to do that. You can call the Medi-Cal eligibility worker and ask, or in your last award, because every year Medi-Cal redetermines your eligibility. In your last notice of action, it may tell you what program you're on. And so
Okay.
once you know what program you're on, you can look up the program to see what the resource rules are. If you're on Medi-Cal, it's for adults 19 to 64 where their income is below 138 of the federal poverty level, or women who are pregnant, children whose incomes are below 266% of the federal poverty level. These are all, they're the dollar figure, right? That you can't go above. But because if you're on the Medi-Cal program, it doesn't matter what you have in your savings account. But if you're on another program, like the ones where resources matter and you're an individual adult, and single, then you can't have more than $2,000 in countable resources, and the money in the bank is a countable resource.
Okay.
So
Thank you.
if you find out what program you're on and you want to talk more about it, reach out to Raymond, and he'll have to create a file and do a conflicts check, and then we can talk.
Okay.
Any other questions?
I don't see anything on the chat, but feel free to unmute yourself and ask the question. Wait, it looks like somebody may have put something. Oh, Raymond. Yes.
Okay, I'll go. So the Magi program is for people who, different categories of people. You have to be below the age of 64. You can't be on Medicare, and they don't care about resources. There's a really good website called California DB101.org. It's on page 17 of the presentation. You can click onto that website and you're going to find information on all these programs I'm talking about today, on the Magi program. And then we have a category of programs called non-Magi. So it includes if you're getting SSI, you've got the Medi-Cal linked to the SSI. If you lose your SSI because you're working, you can get on the 1619B Medi-Cal program. There's the Pickle and DAC programs I'm going to talk about, Medi-Cal programs, the Age and Disabled Federal Poverty Level program, the Working Disabled. So you can go back to work and still, I heard someone say that they lost their Medi-Cal when they went back to work. And I'm like, what? How did that happen when we have the Working Disabled program? Your growth, your countable income can be almost $60,000 and you can still qualify. And if you have expenses that you can deduct, and they don't count any disability income that you earn to determine, the 250%, whether your income is below 250% of the federal poverty level. There are a lot of people who are on this program. We're not going to go through the programs today, but all of these programs are on the website db101.org, and you're going to want to look at it. There's a whole chapter on Magi, and 1619B. I mentioned that if you lost your SSI because you went back to work, you can earn up to $54,082 this year and still qualify for Medi-Cal under 1619B. And you can even deduct stuff from your gross income to figure it out. So there's a link to the 1619B program on page 18 of the slide. Pickle Medi-Cal is a funny name. But so if you're receiving SSI and SSDI, and then there's a cost of living increase in the SSDI, and it kicks you off the SSI program. So what happens when you lose your SSI? You lose your Medi-Cal that's linked to your SSI. If this happens to you, then you can continue your Medi-Cal under Pickle Medi-Cal. And there's a link to more information on the slide 19. DAC Medi-Cal, I talked about DAC benefits through Social Security, but if you were on SSI and you start getting DAC benefits through Social Security, and that causes you to lose your SSI, then you can continue your Medi-Cal under DAC Medi-Cal. There is a program called DAC Medi-Cal. And it, county workers are supposed to reassess people to see if they qualify for any other Medi-Cal program when they lose eligibility for a particular Medi-Cal program. But sometimes this is overlooked and they don't put people on the DAC Medi-Cal when they should have, and they put them on a share of cost program where you have to pay out money for Medi-Cal to kick in every month. So there is a program, a Medi-Cal program for that. Other health coverage, if you can have, someone mentioned earlier about having different insurances at the same time. Yes, you can. You can have private insurance. You can have Medicare. You can have California Children's Services. These are covers physical disabilities up to the age of 21. You can have Medi-Cal, you can have it all. And the way that it works is that Medi-Cal is payer of last resort. So you have to first go through your private insurance, then go through Medicare before Medi-Cal will even, consider the service and payment. So yeah, and you really do want to keep your Medi-Cal because there are things that the private insurance and Medicare don't cover, and so Medi-Cal is the best program around. I mean, it's such a rich program. It offers so much that not even Medicare, I think, even reaches like the level of just scope of services that Medi-Cal provides. So, before we start talking about some changes that are happening in the program, I wanted to stop to see if there were any questions.
I don't see anything in the chat. Feel free to unmute.
Okay, so we're going to look at a publication that was put together by a sister agency called the Justice in Aging, and the publication talks about some changes that are happening in the 7 CCI counties, Coordinated Care Initiative counties, including Santa Clara. Individuals with a Medi-Cal share of cost, because their countable income is too high to qualify for a program without a share of cost, some people are put into a Medi-Cal program where they have to pay out of pocket first a certain amount before they can get their Medi-Cal every month. And if they don't pay their share of cost that month, they don't get Medi-Cal that month. So some individuals with share of cost are being transitioned from Medi-Cal managed care into fee-for-service Medi-Cal. And those are for the CCI counties and 22 coast counties. That's mainly up north and Cal Optima. And that started January 1st of this year. The next thing that is happening, can you just go back to the other one? Because we're going to just scroll down. So the next thing that's happening is there's going to be mandatory managed care enrollment. So some people who are only receiving Medi-Cal and some who are receiving Medi-Cal and Medicare are going to be required to go into a managed care plan. So these people will no longer be in fee-for-service where they can go to any doctor that takes Medi-Cal. And those will be in the coast counties, the most northern counties, and also Cal Optima in Orange County. That started January 1st. The MSSP program, which provides services and supports to people 65 and older, with the Coordinated Care Initiative, when it started out, they said you had to be in a managed care plan in order to get those services. You no longer have to be in a managed care plan to get those services. I think this is really important. The next one, starting January 1st, Medi-Cal managed care plans are supposed to start offering enhanced care management and community support services. So it's defined, and I'm reading, as comprehensive whole person care management that will be available to high need, high cost Medi-Cal managed care enrollees with the goals of better coordinating care, addressing social determinants of health, and improving health outcomes. So, you know, it will be available to individuals and families experiencing homelessness, higher utilizer adults, you know, adults who use Medi-Cal a lot, and adults with serious mental illness or substance abuse disorder. So there are populations that this is going to be the focus of this program. If you're interested in this program, you need to reach out to your managed care plan to see where they are in the process and what the requirements are for providing this. The other thing that happened is that Medi-Cal managed care plans are no longer responsible for drugs. In other words, it's not coming out of their pocket. You won't notice a difference. All the Medi-Cal prescriptions are now going to be fee for service. So you won't notice a difference. And it started January 1st. The next thing, if we can scroll down. Yeah, so I've been mentioning that starting May 1st, anyone 50 or older, forget the immigration status, doesn't matter. And someone had mentioned when we were talking before the training that their Medicare gets paid, $170 get paid, I think. So if you're on Medicare, you have to pay for your Part B and your Part D. And sometimes people pay for their Part A. Part A is mainly hospital costs. Part B is everything else. And Part D is drugs. So there are Medi-Cal. If you're on Medi-Cal, there is a program called the Medicare Savings Program, where depending on your income and your resources, Medi-Cal will pay for your Part A or B or both. And they're eliminating the resource limits for these programs because there are 4 of these Medicare Savings Program, and each program has a resource limit. They're going to eliminate those resource limits by July 1st. Fully eliminated.
So they'll no longer pay for the A and B plan?
Well, no, that they will continue to pay for the A and B. In order to qualify for the Medicare Savings Program, for example, in some of these programs, you couldn't have more than $7,500 in countable resources. They're eliminating the resource requirement. So people no longer have to meet the resource requirement to get the benefit of this program.
Okay.
It's actually a good thing, you know, because in order to be part of the Medicare Savings Programs, your resources had to be below a certain level. These programs have different resource limits than the other Medi-Cal eligibility. But they're going to eliminate that fully by July 1st of 2024. The Cal Medi Connect plan, you know, the one that for people who have Medicare and Medi-Cal and elected to have their Medicare taken over by the Medi-Cal managed care plan in those CCI counties, including Santa Clara, the Cal Medi Connect program is ending December 31st. But people in Cal Medi Connect will automatically transition into what is called the dual special needs plans. And so you have the link to this publication so that you can look at it. And the other very important thing, which will be the other link that you're going to have, is remember I said that things are changing with some of the programs that we deal with. So Lonnie, if you scroll down to the next page, So the resource limits for the programs so there was an Assembly Bill 133 is going to eliminate the resource limits for non-Magi Medi-Cal programs. Those are all the programs that we deal with where disability is a requirement. That is huge. They're gonna completely eliminate the asset test. They're hoping by no sooner than January 1st, 2024, but starting July of this year, they're going to increase the resource limits from $2,000 to $130,000 per individual and $65,000 for each additional household member. So the person who was concerned about the savings, the money in the savings account, if you're on the Magi program, it doesn't matter how much you have in your savings account, but starting July 1st of this year, you can keep up to $130,000 of resources, and they will not count against your Medi-Cal. So this is really good news. And then they're going to do away with the resource limits no sooner than January 1st of 2024. This is really a great thing. So you're going to have the link and the publication that talks about this. Thank you. We're going to go back to the presentation. And I think, oh yeah, I wanted to talk about one other program that California has. If you have private health insurance and you have a high cost medical condition, and your private insurance covers a lot of your high cost medical condition, there's a program in California called the Health Insurance Premium Payment Program, where the state of California will pay your co-pays and perhaps your deductibles for your private insurance. You can't be in a Medi-Cal managed care plan for this. You can't have Medicare, TRICARE, Mr. MIP, which is an insurance program, or county health initiative. You can't be on any of that. But why do they do this? Why is the state of California willing to, and you have to have Medi-Cal, of course. Why is the state of California willing to do this? Because it's cost effective, because a lot of the care is going to be covered by private insurance. And so Medi-Cal ends up paying, a lot less than if it had to pay the whole bill. So I had a case where, anyway, was representing the client, a child, and the father was talking to me, and he said, the state of California pays our health insurance premiums for the family. And I said, well, how much is that? And he said, oh, over $900. And I said, you're kidding me. How is that happening? And he told me about this program. And so ever since, I tell people about this program, because you never know. You can search more about this program, but just type in Google Health Insurance Premium Payment California, and you'll find it. And there's an application and all of that. Additional resources, I'm providing you a link to a manual on Medi-Cal eligibility. Oh, all the programs we deal with, Magi Medi-Cal, it's all there. Health Consumer Alliance is an organization that helps people with their Medi-Cal issues and other issues. Great organization, you can contact them. And then I included a link to Department of Healthcare Services. They issue letters and bulletins and information notices to counties on different issues, and you can find all of them there if you're ever interested in that. We also have a link to our DRC COVID and Medi-Cal, but a lot of that is kind of old news. I should actually just take that out of the PowerPoint because it's really not that important anymore. We're kind of getting out of all of that. So we've come to the end of the presentation.
Diabetes?
Excuse me?
Sorry, will diabetes count for that care program you were talking about earlier?
The health insurance premium program?
The person who, yes, already has private insurance.
If you have private insurance and you're not in a Medi-Cal managed care plan, you don't have Medicare, and you have Medi-Cal, you might
have diabetes.
I'm sorry, what?
They have diabetes or diabetic, and they pay like $400 or $500 a month for their insulin.
Yeah,
Would that count?
I don't know if that's considered a high cost medical condition, but you can certainly reach out to the HIP program, the Health Insurance Premium Payment Program. Reach out to them and see if this would be considered a high cost medical condition. It doesn't sound like it if that's all that they're paying. It's high cost to us, right? Because $400 is a lot.
To her.
But, yeah, for sure. Any other
Oh, thank
questions?
you.
You're welcome.
I don't see anything in the chat. I have placed a lot of the links that Maria had referenced tonight. And when you download the recording, Brandy, you'll be able to also send, the links will be attached to that recording if folks want to access it that way. And all the materials and links she mentioned today will also be in the email sent to you after the training.